Have you ever injured your knee when lifting? Well, that's exactly what this patient did. I'm Zach from PhysioFit, and let me show you exactly what I did to fix it.
So first we start off with our range of movement testing, just to see how his knee is moving. And then we move on to our strength testing. Next, special testing, where he scored negative on the anterior and posterior jaw, as well as the valgus stress test. However, he did score positive on the varus stress test, indicating an LCL sprain. As you can see, his left leg hardly has any laxity, whereas his right leg is able to bend a lot further. And now for differential diagnosis. Here I'm testing for proximal tibiofibular instability, to which he tested negative.
So in conclusion, what we're looking at here is most likely an LCL sprain. More than likely it's going to be a grade 1.
Now we move on to his personalized exercise plan, starting with isometric wall sits.
But the change is we're going to do it at the height just before the pain starts. That way we can start loading that ligament. Then as time goes on, you get stronger, he can start going deeper.
Now an exercise progression for the isometric wall sit using a band above the knee. This is because
with this LCL, the main injury is through what's called a varus movement, where the knee moves out and stretches it. So what we want to do now is work on the hips to twist out to keep everything in line.
And then just some light plyometrics to start getting that knee used to taking load. Finally, we finish off with some IASTM feather flicking, just to get a neurological response on that ligament to give it a bit of numbness, followed by a bit of squatting practice.
And that's it. Stay tuned for part 2. Like and follow to get your physio fix.